Pancreatic cancer is called the silent killer for a reason. By the time most people notice symptoms, it's already stage 3 or 4. But here's what almost nobody tells you. Your body usually does send warning signs months before diagnosis. They're just easy to brush off as getting older. Today I'm walking you through 8 symptoms backed by what oncologists actually look for that seniors and their families should never ignore. Number 5 is the one most people mistake for a totally different condition, and it sends thousands of people to the wrong doctor every year. Stick around to the end because I'll also tell you exactly what to say to your doctor to get the right test ordered, not just brushed off with, let's wait and see. Cut to title card/channel intro, 5 seconds max. Let's be honest about why this matters. Pancreatic cancer has one of the lowest survival rates of any major cancer, not because it's unbeatable, but because it's almost always caught late. The pancreas sits deep in your abdomen, tucked behind your stomach, which means early tumors don't press on anything, don't show up on a routine physical, and don't hurt. So what happens? Symptoms get explained away. It's just acid reflux. I'm just tired because I'm older. My back's been sore for years. Each one sounds reasonable on its own. That's exactly the trap. And here's the part that should really get your attention. Family members are often the ones who notice first, not the person experiencing it. Weight loss that just happened. A change in skin color nobody mentioned at first. A craving loss for food they used to love. If you're watching this for a parent, a spouse, or yourself, the goal isn't to panic. It's to know what's actually worth a phone call to the doctor versus what's normal aging. So let's go through them one at a time. Quick visual break. Bold on-screen text. Slight zoom in, change of camera angle, or B-roll. Quick gut check before we continue. If you or someone you love has had even 2 of these in the last few months, stay through to the end, because symptom combinations matter more than any single symptom alone. Number 1, unexplained weight loss. Losing weight without trying, no new diet, no new exercise routine, is one of the most common early signs. We're not talking about 2 or 3 pounds. Doctors pay attention when someone loses 5% or more of their body weight in 6 to 12 months. For a 160-pound person, that's just 8 pounds. It sounds small, but it's a real signal your body is using energy differently than it should. Number 2, yellowing skin or eyes, known as jaundice. This one's hard to miss once you know what to look for, but families often mistake it for just looking tired or blame it on lighting. Jaundice happens when a tumor blocks the bile duct, causing bilirubin to build up. Watch for yellow-tinted skin, yellow in the whites of the eyes, darker urine, and pale or clay-colored stools. This combination, together, is a same-week doctor visit, not a wait-and-see. Cut to close-up, pause for emphasis, on-screen graphic listing symptoms 1 and 2 with check marks. If either of those rang a bell, don't close this tab yet. Write it down right now, today's date, what you noticed. That note becomes incredibly useful information for a doctor later. Let's keep going. Number 3, new onset diabetes late in life. This is the symptom doctors themselves often miss. If someone over 60 is suddenly diagnosed with diabetes, with no family history, no weight gain, nothing that typically causes it, that's considered a red flag worth investigating further. The pancreas makes insulin. When something interferes with that function, blood sugar can spike seemingly out of nowhere. Number 4, persistent abdominal or back pain. A dull ache in the upper stomach that radiates to the back, often worse after eating or when lying down, is a classic and classically ignored sign. Most people assume it's arthritis, a pulled muscle, or just getting older. The key difference: this pain tends to be persistent and gradually worsening over weeks, not something that comes and goes with activity. Number 5, digestive changes mistaken for IBS or acid reflux. This is the one I mentioned at the top, and it sends people to the wrong specialist constantly. Pale, greasy, foul-smelling stools that float, ongoing nausea, and bloating after small meals can all happen because the pancreas isn't releasing enough digestive enzymes. Patients spend months on antacids or assuming it's IBS before anyone connects the dots. Change of pace, slower, quieter tone, direct eye contact with camera. I want to pause here for a second because I know this list is a lot. You're not supposed to self-diagnose from a YouTube video. That's not the goal. The goal is pattern recognition, knowing when a few annoying symptoms actually deserve a real conversation with a doctor instead of getting waved off. 3 more to go. These next ones are the ones people notice last, but family members usually notice first. Number 6, sudden loss of appetite. Not just eating a little less, A genuine disinterest in food, including foods someone used to enjoy, combined with weight loss, this is one of the strongest combined signals on this entire list. Number 7, fatigue that doesn't improve with rest. Everybody gets tired. This is different. A deep, persistent exhaustion that doesn't get better with sleep or rest and starts interfering with normal daily activities like getting dressed or walking to the mailbox. Number 8, new blood clots without an obvious cause. This one surprises people. Some pancreatic cancers cause the blood to clot more easily, which can show up as a DVT, a blood clot in the leg, or even a clot in the lung in someone with no other risk factors for clotting. Doctors call this a perineoplastic sign, and it's often one of the very first clues, sometimes appearing before any other symptom on this list. Bold on-screen recap graphic listing all 8 symptoms simultaneously. Let's do a fast recap because this is the part you'll actually want to remember. Unexplained weight loss, jaundice, new diabetes late in life, abdominal or back pain, digestive changes, appetite loss, unrelenting fatigue, and unexplained blood clots. One of these alone usually isn't an emergency. 2 or more together, especially weight loss plus any other item on this list, is worth a direct conversation with a doctor. Here's the practical part. If you recognize a pattern here, don't walk into your doctor's office and just say, "I've been tired." Be specific. Say, "I've lost weight without trying, I've had ongoing back pain, and my appetite has changed. I'd like to rule out pancreatic causes." That specific phrasing matters because it signals to your doctor that this isn't vague aging-related tiredness. It's a pattern that may warrant imaging, like a CT scan or an ultrasound, or blood work checking a marker called CA19-9. You are allowed to ask for a referral. You are allowed to ask, what else could this be and how do we rule it out? Self-advocacy, or advocating for a parent, genuinely changes outcomes here because earlier detection is the single biggest factor in pancreatic cancer survival. And to be clear, this video is for awareness, not diagnosis. Plenty of these symptoms point to far more common and far less serious conditions. The point isn't to assume the worst, it's to take a pattern of symptoms seriously enough to get checked rather than waiting it out for another 6 months. If this video helped you connect some dots for yourself or for someone you love, do 2 things right now. First, share it with the one person in your family who tends to brush off symptoms because they're exactly who this is for. Second, subscribe. Because next week, I'm covering the early warning signs of colon cancer that get missed just as often as these. And if you've been through this yourself, or you caught something early because you trusted your gut, drop it in the comments. Somebody scrolling through right now needs to read that today. Take care of yourself and take your symptoms seriously. I'll see you in the next one. End card, subscribe button, plus suggested next video.